Most of the research that's behind the evidence-based practice movement is based on comparing different brands of therapies to relatively inert control groups. What the research shows is that doing something that's intended to work often is better than doing something that's not intended to work. When psychodynamic therapy is compared head-to-head with evidence-based therapies, it does as well or better. So the scientific evidence is that psychodynamic therapy is as evidence-based as any other treatment. I'd say the starting point is that research shows that the quality of the therapeutic relationship counts for therapy success more than anything else. So the skills that are of primary importance for a good clinician are how do you create relationships, including relationships with people who are often very difficult and have problematic relationships. And those skills, how do you create relationships and create helpful relationships, are really at the heart of psychodynamic approaches to treatment. I think the heart of good clinical work, first of all, we're in a field that's constantly evolving. Anything that we learn today is likely to be superseded in 10 years by as knowledge increases. I think critical thinking skills are probably the most important thing that one would want to get out of an education. How do we think psychologically about others? How do we think psychologically about ourselves? And how do we evaluate the available information? I think there's a trend in psychology right now toward people not being trained to be clinicians, people being trained to be technicians who follow instruction manuals written by somebody else and have a sort of toolkit of this technique and that technique. I think in the future there'll be two kinds of therapists. There'll be technicians who follow instruction manuals, and there'll be real clinicians who are able to understand their patients deeply and help them live more authentically. Personal reflection is possibly the most important component of education in clinical psychology. I think there's something a little bit, there's a mismatch between asking our patients to engage in a process of reflection and self-exploration that we haven't engaged in ourselves. Unless we do it ourselves, it's academic learning that doesn't really translate into effective practice.